Alright guys, welcome to the Luso Media's channel once again. Today I'm looking at one of our flagship software called DorthPro Health. So DorthPro Health is one of our major softwares, and amongst all of Luso Media's DorthPro suite all of our list of software. Now DorthPro Health is a software, it's an health management system that is used to manage your hospital, for both hospitals, for laboratories, for anything that has to do with health management. So it manages your hospital from end to end, from the doctor's consultation, from the front desk to your OPD, to IP nurse, to your doctor's consultation, laboratory, pharmacies, general inventory, accounting and billing. All the departments are covered. Our DorthPro lab was actually cut out from our DorthPro Health. So, but in DorthPro Health, everything is intertwined together, end to end. You see your reports from your from the front desk, booking of appointments for patients, sending them messages so they will come when it's due, and also doctors consulting, nurses taking vitals, and also posting or whatever they need to post. Now this video is not actually a tutorial on how DorthPro Health work. There's just a summary. I want to give you an overview of what DorthPro Health entails, what it does, how it works. Not a full tutorial on it. So if you want a full tutorial, a full demo, for you to see how each menu works one after the other, when you can contact us, you can send us a message, you can also comment, write your comments below. Okay, now you can also visit our website dorthprosuits.com and get there. You see you can also message us from there. Alright, so let's look at this. Like I said, there are so many menus in DorthPro Health. DorthPro Health is mainly, the purpose of DorthPro Health is to manage your hospital, both from your front desk, your doctor's consultation. Makes everything seamless. It reduces a lot of paperwork. That's the whole essence of it. So every user has their own dashboard. It's a role-based system where pharmacists have their dashboard separately from the lab scientists, from the doctors, from the nurses. Their dashboard displays differently. So is their functions as well. So the dashboard gives them like a quick overview of what's going on and what they can, quick action they can take. Now if you look at the left here, I'm logged in as an admin. So as an admin, you have mainly all of the menus, right? I'm logged in as an admin. On the left here, you see there are so many menus here. We have the admin menu, which is basically for setup. We have pharmacy menu. This is where you do your prescription, where we have OP prescription from doctors. You can see there is a prescription waiting here. So we have you can reclassify your drugs from tablets, liquids, and consumable. We have OP dispense. We shall look at all of these ones again. We have your general inventory for both your consumables, consumables and non-consumables. We have your we have the financial management, where for expenses and other accounting features. We have general reports for items. We have the financial reports for all of your financial reports. We have the front desk menu basically for checking of patients, registering of patients, for schedule of appointments, a lot of things there, right? Everything always starts from the front desk. I think we'll take a brief. We'll just take one section, just one section to see how it looks like. Okay, so we have a tariff menu where you manage your prices of all your services and your drugs and other items. We have your cash and billing menu. This cash and billing, this is where your cashiers, what they work with to collect money, right? Then we have the human resources, where you have all your staffs, their designation. You manage your staffs here. We have the doctor menu, which is basically for general consultation, for referring patients. You can refer patients from here. You can review your consultation. You can check your inpatients as well. So we have your nurse menu. Your nurse menu here, your nurses can take vitals. They can also post nursing services like wound dressing and all of that, and they can also attend to admission requests from the doctors, and as well as post their progress notes on inpatients, right? And we have the laboratory. Yes, for the laboratory module, for those of us that have used our DorthPro lab, you see there's no much difference here. The difference here is that this one is connected to the doctor's end and also to the EMR of this patient. Okay, so then we have add sample type, where you can add your sample type. You can create your templates for each of your lab results, post results, you can record results, and you can validate view results. Viewing results, you can also send these results to client, to your patient via email or via WhatsApp, right? And we have your records where you can view the EMR of your patient. You can select a patient, type in their name, it shows you all the records of that particular patient, the electronic medical record, the last visit, previous visit. You see everything. If there's all the doctor's note, physical examination, and all of that, then we have your inpatient record for that particular patient. If he has any inpatient record, you can view the lab investigations done by this patient so far, and you can see this one here. There's one pending that has not been posted. You can view all the prescription that this patient has been given over time, if it has been dispensed, and if it has not been dispensed. View all the services that he has done. Okay, that's for your EMR. That's for the records. So there's so much to this, and one thing about DorthPro Health is that just like other DorthPro products, our software is customized to suit you just the way you want. So when you get to your hospital, we look at your flow, we give you what we want, then what we have rather, then we customize it to suit you. It's all of our software is tailor-made right to you. So I want to start. Let's just take a scenario now. Let's start from our front desk. Let's say a patient comes in for the first time. You go to front desk menu. You just simply click on new registration. When you click on new registration, you are expected to enter the patient's name. If the patient is an existing patient, right? If an existing patient, but normally what the front desk are supposed to do, once they come in once a patient comes in, the first thing they're supposed to go through is to click on existing patients, right? Click on existing patient, then you type in the name of this patient, because this patient already exists. It's an existing patient here, right? So since an existing patient, you just type the name. Let's say I type this, let's see, if the person's name is not an existing patient, then you can go and register the person as a new patient. Alright, so if I click on this, you see, attention, this patient is waiting to see a doctor. So you cannot post a patient that is already waiting to see. You're all seeing a doctor already, right? So let's register a new patient. So you select the title, let's say Mr. Select gender, male, the last name, let's say Hataki, for example. Then we have Kakashi. Right, so date of birth is let's say 6/9/1986. So automatically calculates the age, 39 years, marital status, let's say is married. For example, select the religion, Christian, Muslim, let's say others, occupation, let's say it's a business person, phone number of this particular person, very important. So let's say the 7. Okay. And the address of this person, let's say 23, let's say 23 Shipway Way, for example. This just for an example. So a email address, put in the email address, let's say then the next of kin of this person, very important. You have to put in the next of kin of this person. Let's say, put the relationship, let's say brother, next of kin address, you put in the address, phone number, and so on. And you select the patient category. See private. So DorthPro Health manages different type of patients. So there are hospitals that have both private and corporate patients, like your NHIS, your insurance companies that come to register with your hospital. So if it is private, you have to set up your prices for all of your private patients. Then if it is for corporate, so you see we have corporates can come register with you, then discuss their prices with you whenever their patient comes at a particular price you can give to them. Maybe at the end of the month they will come to offset the bill, or you want us to customize it such a way that these patients must pay but at a reduced price. Fine. Then we have for insurances like your AXA, Mansard, so on. There are so many of them, your IGA and all of that in Nigeria here. So all of these insurance group, health insurance group, you can add them as well. Then we have your NHIS, we have your family. So your family can come and register and agree on the price. At any time they come, you will be attended to in this particular case. For your price management, you can set up the prices for each of these. So let's say this person is private, so you can see there's registration here, which is amount due 3,000 naira. So this person is to pay 3,000. If I register, this person is meant to just go and pay 3,000 naira at the cashier, at the cash point for registration, because it's a private patient. But if this person is insurance, let's say this person is from an insurance company, let's say you see you have to select the sponsor, let's say AXA Mansa, is not expected to pay any registration fee because this has been settled by the company with the hospitals already. Okay, so let's make this patient a private patient, for example. So I say private, for example, then you select service access, right? The service access is so let's say if this person doesn't just want to register in one service, then I can just come here and select private, select service access again, then select category. Maybe he wants to do investigation, nursing services, investigation, like maybe he wants to conduct a test or so, or maybe he just wants to see a doctor, which is the main thing. So I click on clinical service, select the clinical service. Let's say he wants to see, then give me just for general consultation, or probably maybe pediatrician. You see all of them comes out. But let's say it's going for consultation. So if I click on consultation, excuse me, if I say consultation, all the consultations comes out, right? So I click on general consultation. Once I click on it, it will bring out all the doctors that are available that are general consultants. However, let's take a look. Let's say if I say, let's say I type obstetrician. So once I click on obstetrician, only doctors that are obstetrics will be available. That obstetricians will be available, right? So let's say I take family physicians, for example. Select the doctor, it comes out. The essence of this is because the doctors that you selected, they will be expecting someone at their own end. They say, oh, someone is coming, right? So you can see all of these services have different prices attached to them. So let's go with general consultation, for example. Select the doctor, let's say this guy, then I click on register. Once you register, system will prompt you to update the picture of this person. So DorthPro allows you to put in the picture of someone, of a patient. So you can snap. Once you snap and you save the picture, so that when the doctor comes in, you look at the person's face. So, oh, this is the person we are expecting, right? So that picture is there. But if you don't want to attach a picture, no problem, right? So at this point, the front desk, they are done with it. And what the person is supposed to do next is to go to the cash and billing point. So cash and billing goes to outpatient payment. Without them making payments, you cannot do anything. You will have to make payment first before you can go to the next phase, because in the next phase is supposed to be nurses. When you come to nurses here, nurse go to open waiting list, you see the person's name is not here. Doctors will not even see. If I go to doctors menu and click on general waiting list, the person's name is not here either. So if we go back to cash and billing, just click on outpatient payment and you click on view. It shows you, okay, well, this is what the person is paying for. It's paying for registration and general consultation. It doesn't want to do the consultation again, you can delete, you can remove it. But if this is paying, just select the payment mode. It's a credit, it's in his wallet. So a DorthPro Health manage different type of payment. So we have deposits, the customer can deposit an amount, and later the system will assume this person is still owing this particular amount. Then, or you can use his wallet. If there's money in his wallet, you can see his wallet is 0 here, or you can see transfer, POS, credit, and so on. Let's say this person is paying cash, for example, 11,000, and I click on post payment, and then you can print the receipt to the patient to show that you have made payment for a particular thing with the name of the patient and everything. Right, so at this point now the patient can now go to take the vitals, which is a normal. So go to open waiting list, you will now see Hatake Kakashi is now here. You can search. You You see the name here. So what nurses have to do is to take the vitals of this particular patient. You can see the information of the patient there. You can add allergy. If the person has an allergy, you can add. So let's take the vitals. Let's say the temperature 32 degrees. Alright, the weight is let's say 89. Blood pressure systolic, let's say 130. Diastolic, let's say 95. And the height is let's say the height is in centimeters, let's say 75 centimeters. You see, so once you put in the weight and the height, automatically calculates the BMI and tells you the status, if it is overweight, obesity, underweight, or so on. Right? So respiration in BPM, let's say 95. Oxygen. So if there are values that you want us to remove that you don't want, we can always remove it, right? So if you don't want all of this, if you want the head circumference, leave it if there's no. That's basically for babies. So if there's a mark you want to put just in the trash category, select this. Let's say green, yellow, red, and so on. Let's say yellow, and add vitals. Once you add the vitals, you see vitals has been added, right? If you think the vitals you entered is not really okay, you want to add more, you can see the complaint. You did not enter any complaint. So if you think this vital is not correct, you want to take it again, you can go over again and take it. But if you're done, you can always edit the vitals of a patient that you have taken. If you maybe you want to edit it, you can go back to edit it, or you want to add a new vital, you can add it. Now, once that day is passed, after that day, you won't see this person's name again for you to take vitals. So at this point, the next point of call now is to see the doctor. You can see when doctor goes to general waiting list, you see this here. Let me first of all log in as a doctor, so you see how it looks like. So as a doctor, for example, I click on this. Or first, let's log in as a nurse. So you see how it looks like. I think this should be a nurse. Okay, so this is a nurse. You can see nursing officer at the top right there. So you see there's awaiting vitals here. You can see these are patients awaiting services. These are patients that register that paid for services that you have not posted. You see they are here, their names are here. Nursing service request 3, admission request 0, current admission is showing that there is a patient currently in admission, right? So there's current admission, so there's awaiting vital signs. So you can click on the awaiting vital signs and post the vitals. These are the nurse menu looks like, the nurse dashboard looks like. Then for the doctor, so for the doctor, you can see there's a waiting consultation. You see now there's one patient, because this patient was assigned to this doctor. The doctor sees at his end here that there's a particular patient that was assigned to me. I can consult that patient immediately. I can call that patient immediately and consult, or I can just be generous and say, okay, let me go to all the general waiting list to call one after the other. Let's say I want to attend only those that are assigned to me. I click on consult. So you see what the person, you see the allergy, you see the vital signs, right? You can even click on vital sign trend. If I click on vital sign trend, it will show you the trend of all the vital signs for this patient that have been taken, to plot a graph of all the temperature, the blood pressure, and everything. There's only one vital sign that has been taken. So I can start consulting for this patient by entering, let's say, what's the present complaint? Headache, history of complaint, let's say 3 weeks. Let's say medical, surgical history, there's none. I can leave all of these ones off. So I can put my physical examination. There's physical examination like pallor, jaundice, and all of that, cyanosis. You can put them if there is. There's systemic examination as well. So here you can examine the eyes, this part of the eyes, cornea, lips, and everything. So all of this can be customized. So then you put in your primary diagnosis. What are we diagnosing for this patient? So let's say what we discovered is having, let's say malaria. What it is. You can also put a secondary diagnosis if there's any. If not, then you can order. As a doctor, doctors have the right to order investigation for this particular person. So let's say this person wants to order, let's say, malaria parasite test. If you click on it, you can see it has been added here. Then doctor can also order tablets for this particular person because we discovered it's malaria. So there are all of the tablets that are here. Let's see, paracetamol, for example. You can see it shows you the quantity, but if there's no selling price, it will not go. So they have to go fix a selling price for that particular this thing. So I click Panadol, let's say 2, frequency, let's say 8 hourly, duration, and for 7 days, automatically quantity is 42. Then oral, doctor's instruction, you can put in your instruction there and you save. If there are more drugs you still want to order, let's say Amatem, good, there's Amatem here. Let's say the dosage is 4, right, 12 hourly, for example, for 3 days. So select your route, oral, so on, then you save. Now as I'm saving this, all of this is going to a different department. For the investigations that we ordered, laboratory persons are expecting that someone has ordered for laboratory, someone is coming, while pharmacists, they are expecting someone coming as well to come and collect their prescription, then go make payment. So consultant notes and remark, at the end of the day, consultant can put in a note: patients need to be treated for malaria, for example, or lifestyle modification, take rest, blah blah blah, and so on. So we put in the consultation status. Is it pending? Maybe you want the patient to go and complete that test first, then come back to conclude. Or you can request for admission. You select the admission status. You see there are different admission here. Then we have the admission status. Is it for short stay? Is it for intermediate stay, observation, or long stay? Then you can close the consultation if you think it doesn't really need anything there. So you can require follow-up. Do you want to follow up this patient? If yes, the system will ask you, select a date when you want the next meeting for this particular patient. You can select a date. So once you select a date, the system automatically programs it. Then for the front desk people will see that there is a schedule, there is an appointment that has been scheduled for this particular patient. So at the end of the conversation has been saved for this person. This person is done. That's the end for the doctor. So doctors can also do for inpatient if admission has been done. So that's all that. If you look at the pharmacist or the laboratory people, they have their own dashboard different as well. Like I said, if you go to their dashboard, you see that their dashboard is different. Let me convert someone, let me change the role of a staff to a pharmacy so that you see how the pharmacy dashboard. Then we'll just summarize and close it from here. So let's say I change to pharmacist, I update, let's log out and log in as a pharmacist again. Let's see. Now, once I log in as a pharmacist, you see this is a pharmacist dashboard. So you see there's a new prescription. There are 2 prescriptions that are coming already. They're expecting 2 prescriptions. So you see their inventory and everything is there. They can track items that will soon expire. You see there are 3 items that have expired here. It's showing there these items that have expired. So there's reorder level for the inventory as well. So the items that will soon reach reorder level, expired items that will soon expire. System tracks all of these. They are all there. So in this case now, let's say we have OP new prescription. You look at this, right? You see, okay, there are 2 people. There are 2 prescriptions here. You see the doctors are prescribed 8. So let's say I go with this Atake Kakashi. I click on view. You see the information, right? So you see vitals, and so the drug prescriptions here. So we have Panadol, Amatem. The pharmacist can also add prescription. You add more drugs if they want to for this particular patient. Maybe that particular one is not available anymore. So they can also update the prescription. They can update the prescription, or they can delete it, right? Or they can post to dispensary. Let's say everything is okay. Yes, okay. Just click on post to dispensary. This one is there. Click on post to dispensary. Once you click on post, you can print the drug bill. This drug bill will be given to this patient, which they will take to the cash point. So once they take it to the cash point, they will go and make payment. Until they make payment, they cannot receive that drug. So the cashiers will be expecting from their own end. Let's convert someone else to a cashier so you see how it looks like, how their dashboard should look like. Let's change this staff to a cashier. So if I click on change user role, let's say change this one to a cashier, update. So Okay, so at this cashier, you see there's daily visit, total payments made today. And this total payment is actually for someone who this cashier can only see the transactions made by her. So if you have multiple cashiers, each of them will be seeing their own transactions, right? So you see there's pending payment. So you see as someone pending payment means someone wants to make pending payment of 28,000, right? So if you come here, they can click on this pencil. Post outpatient payment, you see, right? Okay, after Kakashi is 27,000, they click on view. Once the person tendered that receipt, they can also search with the receipt number that the bill that was given to them. They can search with it or with the name. So you see all the things. There's malaria parasite, there's Panadol, there's Amatem Fort on it as well, because this person is also paying for what's it called, for lab as well. So it's added there. So this one has been added to the lab payment. So they can remove the lab if they don't want to pay. But if they are paying this, you can select, click on what's this, see cash, on POS and all of that. So you select your mode of payment, let's say cash, post payment. So once you post payment, the cashier at the end of the day, you see this is the transactions he or she has made, the payment he has collected today. At this point now, this client can then go back to the pharmacy. Once you go back to the pharmacy, then they can then dispense the drug. Only when you've made payment. If you go to the pharmacy, you see now there's one OP pending dispense. If I click on it now, you see, okay, this guy has made payment, then we can then dispense the drug. So we can dispense now from the system. You have to dispense from the system. You can also print the drug prescription for each of the drugs. So you can print prescription to the patient and give to them for each of the drug that is taken, so that to show so that in case the patient is having difficulty, maybe you don't want to write it, you can just print it to the person. For each drug, you just print a prescription for it. And after printing, you can then post, so it will be removed from the inventory. So you see, click on dispense. Alright, that one has been dispensed. Click on the next one. You select the batch from which you are dispensing from, and you dispense. So after dispensing, drug has been dispensed totally, and that's the end of that transaction for that day. See, so it shows you the drugs that you have dispensed for the and the patients seen today. That's basically how the pharmacies work. So pharmacists can also attend to patients that are not non-registered patients. Let's say they can do retail sales order. So we have walk-in patients and registered patients. Maybe it's not the doctor that prescribed for them, so they can attend to these walk-in patients, create their name and order drugs for them. Then for the lab, what they will be expecting, the patient to come. When the patient comes, you see this. Once you go to the first point of call is sample collection, where you see all of the samples that are pending. You only see them if they've made payment. These are persons that have made payment for their samples, and their age. So after Kakachi, it's actually first come first serve. Collect your sample, blood, and all of that. Yes, it's blood. Then after collecting sample, they have to wait, then post your lab results. Right? There are templates that has been created for each of these lab results. You can create your template by default. And once you post the results, the system automatically brings out the template. All you need to do is to enter your result. We program this so you can put in more information if you want to enter, let's say, malaria scene. So there are certain results that are value based. There are some that, for example, there's a range of values. System will tell you if it is high, if it is low, and all of that. That one has been programmed in the system. As you are entering your values, the system will be calculating the values for you. So you can view the result, you can print it and give to the patient, or you can send via WhatsApp, and you can also send to the email of this patient. If I click on WhatsApp, it opens WhatsApp on my system and it sends to this person. Or you can print the result and print it from your printer, so it shows you everything with your with the signature of the scientist that posts this result. So that's basically it. You can validate a result just to check that, okay, this result was good, so there's be a validation stamp on it. So this is DorthPro Health for you. There are a whole lot that I have not mentioned, but basically everything works end to end, from the doctor's menu, laboratory, nurse, and all of that. Like I said, there's also the inpatient menu. So for example, if I go to doctor's menu and click on inpatients, you see patients that are currently on admission. You view them, and you can check them. You can check their status, the previous the consultations, vitals, and you can also document, put in your progress note, and all of that. Like I said, so this is DorthPro Health for you. Manages your health, your hospitals, laboratories, and all of that from end to end. And we can customize it to suit you. So you can send us a DM, you can send us a message if you want a full demo of this, how it works, and you can also give you, if there's anything you need to know about it, how to implement this, you can let us know. So thank you very much. There are other videos attached to to see other videos on all of our other softwares like DorthPro Health, DorthPro Accounting, DorthPro Loan Management, Sales and Inventory, Point of Sales, and so on, and also Retail Management. So see you again on our next video.